Good morning, Andy Parker. I am Mihiraa. Let's start the warm-up sessions. Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
You can now start your OET roleplay.
Good morning. My name is Andy Parker, and I'll be your nurse today. How can I assist you?
Hi, Andy. I've been experiencing some symptoms, and I'm not sure what's going on.
I'm sorry to hear that. Before we proceed, how may I address you?
You can call me Mihiraa.
Mihiraa, can you describe what you've been experiencing in detail?
Sure, I've been having a runny nose, itchy eyes, and sneezing a lot, especially when I'm outdoors.
That sounds uncomfortable. How long have you been experiencing these symptoms?
It's been about 2 weeks now.
I see. Have you tried any treatments or remedies so far?
Yes, I tried taking over-the-counter medication, but they don't seem to help much.
Mihiraa, based on the symptoms you've described, there's a possibility that you might be experiencing hay fever, which is a seasonal allergy. This happens when the pollen count is high, especially during certain times of the year. Don't be upset, it's a common condition, and while it can be quite uncomfortable, it's not usually serious. There are several treatment options available that can help manage your symptoms effectively. One option is over-the-counter antihistamines, which can help reduce sneezing, itching, and runny nose. Another effective treatment is nasal corticosteroid sprays. These can help reduce inflammation in your nasal passages, providing relief from congestion and runny nose. It's important to use these sprays regularly for the best results.
Okay, I'll give that a try. Is there anything else I can do to manage my hay fever symptoms?
Yes, Mihiraa, there are a few more ways you can help prevent hay fever symptoms and make your daily life more comfortable. Try to stay indoors as much as possible when pollen counts are high, usually in the early morning and late afternoon. After spending time outside, it's a good idea to take a shower and change your clothes to remove any pollen that may have clung to you. This can help reduce your symptoms significantly. Additionally, keep your windows closed, especially on windy days, to prevent pollen from entering your home. Using air conditioning both at home and in your car can help filter out pollen and other allergens from the air, providing you with cleaner air to breathe. These small changes can make a big difference in managing your hay fever symptoms.
That makes sense. I'll try to follow those tips. By the way, what if the symptoms worsen?
Great. I'm glad those tips make sense to you, Mihiraa. While many people find relief with these methods, it's important to know what to do if your symptoms persist or worsen. If your symptoms persist or worsen despite trying over-the-counter treatments and preventative measures, it's a good idea to contact your GP. They can assess your situation and suggest other treatment options that may be more effective for you. Moreover, if your symptoms are significantly affecting your daily life, we can also consider consulting an allergist. Allergists specialize in treating allergies and can offer more targeted therapies. Your health and comfort are very important, so don't hesitate to reach out for professional help if needed.
All right, that's great. Thank you so much for your help, Andy.
You're welcome, Mihiraa. Let's review our conversation to ensure you have all the information you need. You came in today with symptoms of a runny nose, itchy eyes, and frequent sneezing, which you've been experiencing for about 2 weeks, especially when outdoors. You mentioned that over-the-counter antihistamines haven't been very effective for you. Based on your symptoms, I suspect you might have hay fever, a common seasonal allergy triggered by high pollen counts. It's uncomfortable, but usually not serious. I recommended trying different over-the-counter antihistamines and using nasal corticosteroid sprays regularly to help manage your symptoms. In addition, there are some preventative measures you can take. Avoid going outside during high pollen times, typically early morning and late afternoon. After being outdoors, take a shower and change your clothes to remove any pollen. Keep your windows closed and use air conditioning at home and in your car to filter the air and reduce pollen exposure. If your symptoms persist or worsen, it's important to contact your GP. They can provide further evaluation and suggest other treatments. If your symptoms are significantly impacting your daily life, consulting an allergist may be beneficial as they can offer more targeted therapies. Remember, your health and comfort are very important, so don't hesitate to seek professional help if needed. I hope you feel better soon. Take care.